Hey, good morning.
Good morning.
So you had surgery in February, correct?
That's correct.
Of your lower back.
My lower back is good.
And you'd had a previous surgery 3 or 4 years ago, and you had an adjacent level stenosis causing neurological problems, which you've recovered now since February.
That's correct.
All right, all right. Now you had another thing happen about your neck. Can you tell me about that?
Well, I had an MRI done and it showed stenosis in my spine and my neck and my lower back. And to my surprise, when I went in to see a doctor at the University of Miami, he didn't want to talk about my low back or the numbness in my leg. He wanted to talk about my neck. And so far he was concerned, it was an emergency and he needed to schedule surgery right away. So in that first meeting, he put me on a surgery calendar for surgery on my neck, which the MRI did show there was stenosis there, severe, with signal change.
And I would like to add in, not really as bad as he portrayed. I looked at that, but go ahead.
Well, the point is that I didn't quite totally believe it, so I went up to Mr. Rue at New York Presbyterian for a second opinion, and he agreed with it, that I should have surgery right away on my neck. The weird part is that I did not have any symptoms of the nerve compression in my neck. In spite of the MRI, I didn't have incontinence. I didn't have any symptoms anywhere except in my lower leg. And I have carpal tunnel too, which might have confused him. But the strange part is that I came back and saw John Nordt, and John said, no, you're not a candidate for surgery on my neck because I don't have any symptoms. And after 6 months of physical therapy, John finally consented to do a laminectomy, which was wonderful. The numbness is not completely resolved, but has helped a lot. Muscle strength is recovering in my calves and whatever the extensor abductor muscles are on your lower leg. So I'm walking better and I can almost stand on my toes again.
But your neck surgery was never done. It was recommended a year ago and never had to be done.
And that's correct. So far, so good.
Thank you. Thank you very much. All right.